He introduced a catheter into the right femoral artery, draw 50 milliliter of blood during systole and inject it to the left femoral artery during diastole. See what is happening. When I withdraw 50 milliliter of blood during systole, I will reduce afterload. Am I right?
Yes.
During systole, I withdraw 50 milliliter. And if I inject it during diastole, I will increase the venous return or end diastolic volume. Via this mechanism, it can help failure heart to increase its contraction. At that time, this technique had not been successful because withdrawing blood and injecting it through vascular bed causes forming of blood clots. But American surgeon by the name of Contreras invented a gadget, invented an apparatus, introduced a balloon in from the right or femoral artery near the root of the aortic valve and inflated via that gadget during diastole. See, suppose that this is aorta. This is aortic arch. In arch, you will have right common carotid. Yeah, this is innominate or brachiocephalic, right common carotid, and this is left common carotid, and this is subclavian artery. If you introduce a balloon from, for example, right or left femoral artery into the aortic root, near the tip of the subclavian artery, and inflate it during diastole. 50 the volume of this balloon is 50 milliliter normally. 50 milliliter of blood going up, 50 milliliter of blood going down. When it goes up, here you have aortic valve. Beside the aortic valve is the origin of coronary artery. How many leaflets does it have? Three. This is called non-coronary leaflet. From this one, right coronary artery, this is called left main. From this leaflet, left main coronary artery is originated. From this cause, RCA, right coronary artery, is originated. Then from left main, two branches, LAD and circumflex. See, when 50 milliliter of blood is coming into the root of the aorta, coronary artery will be nourished with the blood, and the cardiac muscle cell will relieve from the cardiac failure signs. So there is a console, there is a central gadget in which a pump will inflate this balloon during diastole and deflate during systole. But there should be something to inform the gadget that the diastole is initiated. There should be a mark for the gadget to initiate inflating during diastole, in the early diastole. What shows you the early diastole? This dichrotic notch. This dichrotic notch or incision means the initiation of isovolumetric relaxation of the wrist. When you inflate this balloon during the diastole, this curve will be changed to this 50 milliliter of blood coming into the aorta. This dichrotic notch may have an M-shaped, you see, this is called this part. This is the systole, see, what this called this one, diastolic augmentation. Controvitz introduced this gadget at the age of 92 or something like that. Controvitz and his brother both were suffered from cardiac failure and used this gadget for